Innovation needs world-leading research and skilled people to get off the ground, no more so than in medicine, where the development process can take years and collaboration across disciplines and boundaries is critical to success. Investments by the Engineering and Physical Sciences Research Council have contributed to more than £650 million in savings for healthcare services in the UK alone. Sue Saville reports.
What these PhD students are creating here in Glasgow is likely to revolutionise the way we receive and benefit from healthcare. With investment from the Engineering and Physical Sciences Research Council, the EPSRC, the team work closely with clinicians to produce solutions to novel challenges.
We essentially speed date each other, the physical scientists and the clinicians, the biomedical. So we get together and we talk. The physical scientists can be going, oh, I've got this technique. What could you use it for? Or them saying, we've got this problem, how could you go about solving it? The EPSRC funding is vital. This centre wouldn't exist without the EPSRC funding.
More than 50 centres for doctoral training related to innovative healthcare research are supported by the EPSRC. Even the students think it's excitingly sci-fi.
My main motivation is to try and develop what's so-called Star Trek physics, the idea that you can just use light to detect if someone's ill or to treat them and things like that.
If we are aware of the funding that's out there and the routes that we should be thinking of whilst we're doing our experiments here in the lab, then we can think more cleverly about the design of these experiments, and then that'll help us commercialise these things quicker.
And that's the point. Research at this level is certainly costly, but in the long run it will save time, money and lives.
The work in these highly sophisticated laboratories is being translated to bring the lab to the palm of the hand. A sample loaded with nanoparticles is put inside the device, and then if I just press this button, a laser will scan for biomarkers, and within just 4 seconds, the clinician can diagnose the patient.
Another multidisciplinary venture funded by the EPSRC is underway in Edinburgh. The Proteus project draws on optical physics, chemistry and mathematics to touch and tell disease in hitherto inaccessible parts of the body.
So what we have here is a tiny optical fibre, and as part of the Proteus project we're developing fibre-based sensing so that we can pass fibres deep into tissue and sense disease deep in areas of the lung that we've not sensed before.
This research takes ideas from the workbench to the bedside. The Proteus project's clinical lead steps from the university across to the hospital.
So the EPSRC, as the push of science, is the fundamental way that we will innovate in healthcare. So as clinicians, we adopt technology, and I think historically we've not been driving the technology. Rather than just being handed something, for us to be involved in actually developing it.
We're developing sensor systems which will recognise and identify bacterial organisms.
Creating an early warning system for infectious diseases is the aim of the iSense collaboration between 5 universities, Public Health England, clinical and commercial partners such as Microsoft and Google, with an £11 million investment from EPSRC.
We have everything in terms of, in the UK in terms of the technology, the engineers, the computer scientists. The investment of EPSRC in something which is multidisciplinary, cross-institute, collaborative research is hugely important, because otherwise it just wouldn't be done, it couldn't be done.
EPSRC has invested at least £650 million in healthcare-related research, taking pride in training people with medical and engineering backgrounds together.
So the UK is world leading in some of the areas of research, and by training people together and letting them kind of grow up together in those 2 environments, we can produce really great people, really well placed for the next generation of science problems that we face in the UK.
As healthcare moves into a digital age, it's vital that the researchers and clinicians are supported today to transform the patient care of tomorrow.